Good afternoon, ladies and gentlemen. This is Dr. Razack Amir. I'm an adult nephrologist working at Johns Hopkins Aramco Healthcare. I'm an adjunct assistant professor of medicine at Johns Hopkins School of Medicine, and also I'm the chief office of the academic affair. The purpose of this presentation is really to orient the audience about the function of the kidney and how important it is. And also it's concise with the upcoming World Kidney Day, which happens every year around the beginning of March. So the purpose of my presentation is to give you some facts about the kidney, how it functions, what things can make the kidney function worse, and how you can protect your kidney. So to start with, let me explain to you about our urinary tract structure, or how is the urine is made in the body. So the first thing is that our urinary structure, tract structure, is made of two kidneys, a ureter, and a bladder. The kidneys are small in size. It's about 150 grams in size and measure around 11 centimeters at length. We have two kidneys. Each kidney has filtration unit. We call them nephrons. The important facts about the kidney and how is our amazing kidney function. Many people are not aware that 25% of the blood which pumped from the heart goes directly to the kidneys. And this allows the kidneys to filter the waste and get rid of excess fluid from the body, and then return the clean blood back to the circulation or to the heart. This mechanism happens 50 times a day. So your blood gets cleaned up to 50 times daily. Around 200 liters of blood gets to the kidney and gets filtered in the kidney every day. And about 1.5 liters of that fluid comes out as urine that we pee in an average every day. This to give you a conceptual view of what I'm talking about volume-wise. This is a gallon of water, which people are familiar with. It's about 19 liters in capacity. So our kidney filter around 10 of those a day to make up to 1.5 liters of urine per day. The amazing things about our kidney is that there is a very small unit. We call them nephrons. These nephrons are the little factory which actually filter the blood, get rid of waste, retain the good minerals and the good nutrient back to the body. When we are born, as an adult, we are born with 1 million of those nephrons per kidney, in each kidney. Males have more nephron than the females because males have more muscle mass. And the muscle mass is the one which actually produces more waste. So because males have more muscle mass, they require more filtrations system to clean their the waste out and return the blood to its perfect level. Important fact about this nephron, the nephron is shaped like a cone with a tubing. The cone, there's a ball of blood which comes in the middle of this cone, and where the filtration of the blood constituent and the plasma happen there. And then through many processes and mechanisms inside those very, very tiny tubules, most of the reabsorption of the good nutrient and excretion of the waste happen. Each nephron is about 3 to 5 centimeters in length. And if we put each nephron next to each other, we're talking about 18 kilometers long of tiny tubes. Amazing, amazing. So what the kidney does? First of all, it removes the waste and the excess fluid from the body. So whenever I eat, there is two ways of getting rid of the waste from my body. The kidney will make urine, the GI tract or the gastrointestinal tract will produce and excrete stool and feces. So if you are dehydrated, your kidney will try to retain the fluid and will not allow your body to lose fluid in the urine. And therefore, when we are dehydrated, our urine is concentrated and have a very small, very strong smell. This is just because it is concentrated. And when we have excess fluid in our body, the kidney automatically will excrete the excess fluid from the body to maintain an equilibrium balance in the fluid status in the body. It does also control the body chemical balance. We are talking about the acid-base status of the blood. And this is very important for the health and the well-being of all the cells in your body. It also produces hormones similar to the pancreas, similar to the other things. However, the hormone that produced by the kidney is very specialized hormones and unique hormones. It produces a hormone called renin, which actually control through various mechanisms and reaction the blood pressure in the body. So patients who have chronic kidney disease and the kidney does not function well, they have imbalance of the hormone secreted from the kidney called the renin, and this may result in high blood pressure, which is common finding among patients with chronic kidney disease. It also does a very amazing job. It produces a hormone called erythropoietin. Erythropoietin is actually a hormone that stimulates the bone marrow to produce more red blood cells. So more red blood cells, more beta hemoglobin. So what is expected when you have a kidney problem, that this hormone is not excreted, not secreted from the kidney, and therefore the bone marrow does not get stimulated, and therefore the patient will have anemia, a common feature of patients with advanced chronic kidney disease. It helps to produce active vitamin D. In your body, the liver makes the vitamin D, which is in inactive format. And by going to the kidney, there is a process called hydroxylation. This chemical reaction changes the inactive vitamin D to a very active vitamin D form, which is important to support the health of your bones. It filters the minerals such as calcium, and of course we know calcium is very important for the bones. So to give you an idea about the magnitude of the problem and its economical effect on all the countries in the world, we're talking about 10% of the population in the world, the whole world, are affected by chronic kidney disease. This is about 850 million of the population of the globe, of the world. And this is almost double the numbers of patients with diabetes and almost 20 times the number of the patients with cancer or AIDS. So to simplify it for the audience, we are talking about one person out of 10 will develop chronic kidney disease in their lifetime. When we talk about kidney disease, we're talking about different stages, and different stages matter for us as a nephrologist and matter to the healthcare worker, because we don't want people to progress. Stage 1 being the mildest or the earliest stage of chronic kidney disease, to stage 5, which is very advanced, where the patient will require some form of renal replacement therapy. It could be in the form of dialysis or transplantation. So when we talk about stage 1 chronic kidney disease, we're talking about a kidney function beyond 90 mLs per minute, which means 90% of kidney capacity. When it comes to stage 2, the kidney function will be around 60 to 90% of its capacity. And stage 3, there's a further deterioration of kidney function. We are talking about 30 to 60% of its capacity. Stage 4, when the kidney function is between 15 and 30% of its capacity. And again, stage 5, which is advanced chronic kidney disease, when the kidney is actually failing completely and the patient will require dialysis. This is the time when the kidney functions is only around 15% of its capacity. So what are the common causes of chronic kidney disease or end-stage renal disease? By far, the two commonest causes are diabetes and hypertension. Diabetes mellitus contribute to almost 40% of all the cases of end-stage renal disease, while hypertension can come second in the rank and contribute to almost 36% of the total patient with end-stage renal disease. Diabetes and hypertension they come hand in hand, and there is probably another 20 other causes of chronic kidney disease, which I did not mention in my slide, but I wanted to highlight the importance of those two major player contributor to the end-stage renal disease, which are diabetes and hypertension. We're talking about here 75% of the total number of patients with end-stage renal disease. The cause of their renal failure is due to diabetes and hypertension. So what are the symptoms of kidney disease? Initially, most of the patients, by far, they don't have much of symptoms. As a matter of fact, patients, when they are stage 1 or 2 or even 3, they don't manifest a lot. They don't come to the clinic. Most of the finding will be through their blood test or urine test, which will detect some abnormalities. And therefore, they come referred to us. And when we see them in the clinic, early in the disease involvement, they usually deny having any symptoms. As a matter of fact, they wonder why they are seeing the doctor. They don't have pain, they don't have, they are making good urine. So what's the problem, doctor? We have to educate the audience and the patients that early kidney disease usually have no symptoms. As we progress, people may find that there is specific finding in the urine. The urine may become scanty, means less in quantity. The patient may have froth in the urine. And when we say froth in the urine, like bubbles on the urine when you pee on the commode, the froth or bubbles may be formed on the surface of the water. And patient or family, they may think that, there may be some detergent, cleaning detergent in the tub or in the commode or the tub, and therefore this froth comes out of it. Really not. The presence of froth in the urine usually indicates the presence of protein in the urine. Normally, we excrete a very tiny quantity of protein, but when you have kidney disease, the kidney will not be able to retain protein and will have more spillage of protein in the urine. And this protein will maintain the surface tension on the surface of the water and make bubbles. These bubbles are different from the bubbles you see from the cleaning detergent. They will not disappear. They will stay on the surface of the water maybe for half an hour or even an hour. So this is a sign that you may need to see a doctor. Swelling of the face or around the eye, we call it periorbital puffness or swelling, which happens sometimes early in the morning when people wake up from the sleep, and or swelling in the hands or the lower extremities are common findings with patients who have a lot of protein in the urine or if they have an advanced kidney disease and they are retaining a lot of fluid in their body. Later on, as disease progresses, people will become short of breath because they may have water in the lung or around the lung. They become easily fatigued and tired from a very simple tasks, uh, and and uh, and this is usually related to the anemia or a low hemoglobin, which is common finding with patients with advanced chronic kidney disease. Headache may occur due to fluid retention or because patient may have high blood pressure. Even the patient who has high blood pressure, they may notice that actually the blood pressure is becoming poorly controlled than the usual. And this is a very important finding that demand referral to a nephrologist or to be seen by the primary care physician taking care of the patient for further adjustment of their blood pressure medications and investigating the issue. As the kidney disease progress, the patient lose their appetite, they become nauseous, they may vomit also. Itching is also a finding with advanced kidney disease. Surprisingly, pain is not a feature of chronic kidney disease. Flank pain used to happen or commonly happen in patients with infection in the kidney or if they have kidney stones. But generally speaking, as we said, the commonest cause of chronic kidney disease are diabetes and hypertension. Both these entities will not cause pain in the kidney or the flank area. So what's happened if the patient lost their kidney function? We have to offer them what we call renal replacement therapy or something to replace the kidney function. There's three modalities for this. Either we offer them what we call hemodialysis, so filtration of the blood into a dialysis unit. So the blood will come out of the patient dialysis access, goes into a filter, and this filter actually get rid of all the waste products and excess fluid, and the blood will come back to the patient purified and filtered and cleaned. The second way of doing dialysis is actually using the abdominal cavity as a whole, where we put fluid, a dialysate fluid inside the tummy, and we use the membrane which actually lining the abdomen. We call it peritoneum, the peritoneal membrane. And this membrane acts as a filter. So the patient, they can put fluid in their tummy and remove it. And by this exchange of fluid, there will be filtration of the waste and excess water from the patient body. And of course, the ultimate renal replacement therapy is actually kidney transplant. I'm showing you a pie chart. Data was obtained from the SCOT, the Saudi Center of Organ Transplantation, and these data go back to 2017. And you can see by far hemodialysis is the modality of choice for most of the patient. Some of the patient will go for peritoneal dialysis. However, the minority receive kidney transplant. And why is that? Just because there's a major shortage of organ, not in Saudi Arabia, but it's worldwide. And unfortunately, because of that, and because the existence of the culprit, diabetes and hypertension, and other kidney disease, there is a rise in the number of the patients who are receiving dialysis in Saudi Arabia and in the world at large. So in year 2000, there were only 7,000 patients receiving dialysis in the kingdom here. And in 10 years' time, this number almost doubled. And there is an incremental increase by almost 700 patients every year. It is actually reached 21,000 patients receiving dialysis in the kingdom as per 2020. So how I can test for a kidney problem? Well, it's very simple. First of all, we can do a urine and a blood test. The urine is the eye of the kidney. It tells us a lot of things, you believe it or not. It can show if there is blood, in the urine. And by the way, when we talk about blood in the urine, we're talking about a microscopic blood, so something you cannot see it by your naked eye. And of course, there's also high protein or a protein content of the urine. And we, of course, we can examine the urine under a microscope and we see other features of any kidney ailment there. The blood tests will give me an idea about the kidney function at large. And of course, it tells me about the chemical profiles and the electrolytes of the patient. So the blood and urine test are very easy tests and it can tell us a lot. Sometimes we allude to getting imaging study just to look at the kidney size, the morphology, if there is stones, if there is an obstruction or anything like that. And it tells us a lot also. So sometimes we order imaging studies primarily in the form of an ultrasound. Sometimes we order special tests, special imaging studies, such as CT scan of the kidneys or so forth, depending on what we are thinking as a nephrologist. Occasionally, and very occasionally, we need to have a tissue from the kidney itself to find out what's wrong with this kidney. And this is what we call it kidney biopsy or renal biopsy, which was obtained by a needle. There's no cutting, no nothing. It's just passing a needle from the skin to the kidney. And obtaining a small tissue and a small fragment of tissue, of the renal tissue, and examining it under a microscope. Sometimes we do also more extensive work on this tissue by sending it for electron microscopy and doing more fancy studies just to delineate what is the pathology behind the patient chronic kidney disease. So in my final slide, here's some of the tips to improve your kidney health. First of all, maintain healthy weight. Obesity is a major problem, and we know that it's a pandemic issue, really, affecting globally most of the countries, especially the developed countries. Healthy weight is very important because obesity by itself can cause kidney problems. We always advise to reduce your salt intake. We're talking about 4 to 6 grams of salt per day. Very, very important. Salt is the enemy of the kidney. It elevates your blood pressure. It increases the protein spill in the urine. It can cause even fibrosis or direct damage to the kidney. So very, very important to reduce the salt intake, the diet. For those who are pre-diabetic or diabetic, you have to maintain a very, very good blood sugar control. So your blood sugar has to be well controlled, and your hemoglobin A1C, which is the reservoir of your blood sugar level over the last 3 months, it should be around 7% or less. Blood pressure control is super essential, whether you have diabetes or you're not diabetic. Blood pressure control for those who have chronic kidney disease, it has to be lower than 130 over 80 millimeter mercury. For those who are normal, just maintain a normal blood pressure. And does not happen by itself. It happens by reducing the weight, reducing salt intake, and doing physical activities. And if you are hypertensive, you need to be on the right combination of medications. Physical activity is essential because lifestyle modification, which include physical activity, is an essential thing in the management of diabetes and hypertension. The expert state that 30 minutes of physical activity 5 days a week is excellent. If you are a smoker, please stop smoking. It's a bad habit, and unfortunately, it's not good for your heart, for your blood vessels, your kidneys, and other organs too. And please do not take over-the-counter medications without consulting with your doctor, especially if you have a kidney problem. Medications which are over-the-counter are not meant to be taken especially if you have a kidney problem, without consulting your physician. Especially, I'm talking about the non-steroidal anti-inflammatory drugs, which are the usual analgesic like the ibuprofen, the Polestan, the naproxen, the Voltaren. These are medication very good analgesic for the pain, but unfortunately, they cause a bit of harm, especially for patients who have kidney problems. Finally, eat healthy and hydrate yourself. When we talk about hydration, we're talking about for an average adult, anywhere between a liter and a half to 2.5 liter, 2.5 liters. It's good enough. If you have kidney stones or you have urinary tract infection, then you may have to increase your fluid intake to wash the urinary tract and get rid of any bugs or crystals or any debris in the tract which can precipitate stones and make the infection worse. So we are talking if you have a kidney stones or urinary infection, we are talking about 2 to 3 liters of water a day. I hope you benefited from this lecture and stay safe and take care of yourself. Thank you very much.